PCOS is a condition of androgen excess and ovulatory dysfunction. What this means is that androgens, these are a classification of hormones that we designate as a predominant male hormone. When these are high, it leads to symptoms that we're used to or that we're familiar with in PCOS, such as cystic acne, which is raised red bumps that tend to happen along the chin and jawline. Other symptoms include hirsutism, which is the technical term for unwanted excess hair growth. And this is in places such as the beard line, in between the legs, around the nipples, chest, and back. Other symptoms of androgen excess include hair thinning or hair loss. Female pattern hair loss is going to be found at the part and at the crown. And then also mood swings such as anger and irritability. Ovulatory dysfunction is when there's a lack of regular ovulation. And so even if you bleed regularly, where you're like, oh, about once a month I have a bleed, it doesn't actually guarantee that you're ovulating. And in fact, PCOS is the leading cause of infertility due to ovulatory dysregulation or dysfunction. So one of the things that we want to be evaluating in PCOS is if you are in fact ovulating. And kind of a tip here is that if your cycles are regular, but they're at around the 35-day mark or greater, this is usually a sign that you're probably not ovulating, or at least not ovulating every cycle. In conventional medicine, the way that we evaluate for androgens is typically free and total testosterone. However, when I'm working with clients, I'm also measuring other androgens because testosterone is not the only androgen. There's a metabolite that we look at called a 5-alpha-DHT, which is dihydrotestosterone. 5-alpha-DHT is actually around 5 to 8 times more potent than testosterone. So it's even stronger. It has a stronger androgenic effect. In some cases, I've seen PCOS clients whose testosterone was in the normal range, which raises questions and makes them, shake their head. But again, in conventional medicine, we're only looking at really one marker of androgens. And so the 5-alpha-DHT can help us to see if there is a metabolite of testosterone that's high. And so what sometimes happens is testosterone will get metabolized very fast. And so it could look normal, but the 5-alpha-DHT could be high. And if 5-alpha-DHT is high, this again, because it's a more potent androgen, it can cause actually more severe androgenic symptoms. And then there's another androgen we look at, particularly in the urine testing, the Dutch test that I do. We can also look at this in serum. It's called DHEAS. DHEAS is actually a stress hormone. It's an androgen, but also it acts as a stress hormone. It comes from the adrenal gland, and the adrenal gland is the organ responsible for making and secreting stress and survival hormones. So when DHEAS is high, it helps us to get a little bit of a better picture, because now we can start looking at the stress picture and looking at the adrenal gland function. So what do we do if androgens are high? Well, there are many herbs and treatments natural treatments for high androgens. I'm going to name a few. You may be familiar with these. NAC, N-acetylcysteine. Other ones include things like saw palmetto, licorice, nettle root, pygeum, white peony, EGCG, which is the active ingredient in green tea, and then myo-inositol. However, if you don't get to the root cause of your elevated androgens, it's no different. Using these compounds, it's no different than using a Band-Aid like medication, such as metformin, spironolactone, or finasteride. So we don't just want to say, oh, I have high testosterone and start throwing all of these things at it. We have to really understand what's driving it. So the root causes of elevated testosterone include inflammation, stress, blood sugar dysregulation, and so we need to test in order to address it. So we need to test to know what we're looking to treat. Insulin stimulates androgen production. So as it relates to blood sugar regulation, we want to there's a bunch of labs we want, but one includes fasting insulin. And then ideally, if you can get a 2-hour oral glucose tolerance test with insulin, that's going to be your best bet. Inflammation acts on the ovaries to produce androgens. Also, inflammation can cause insulin resistance. And so you can kind of have a double whammy here. You won't always have inflammation if you have insulin resistance, and the other way around. These don't always go hand in hand, but they're very much related, and they could go hand in hand. Which is why almost always, if you come in with a diagnosis of PCOS, your doctor puts you on metformin, even if you don't necessarily have a blood sugar issue, because metformin can reduce inflammation, reduce insulin, and reduce testosterone. So for inflammation, the test to use is something called C-reactive protein. So when you go to the doctor, ask for C-reactive protein, CRP. I like to use HSCRP, high sensitivity C-reactive protein. Now, another thing is stress depletes minerals, and mineral dysregulation, this is kind of like a circle here, mineral dysregulation is a source of stress in itself in the body, a stressor in the body. Stress will also inhibit the brain from communicating to the ovary, and so that's responsible for a lot of the hormonal imbalances that we see in PCOS. And also, if there's stress, as I already mentioned, it will increase the production of DHEAS, which is an androgenic compound. Adipose tissue, which is fat tissue, makes an inflammatory cytokines, which are inflammatory markers. And so when there is an excess of adipose tissue, we have more of these inflammatory markers, and that then is a contributor to the inflammation picture, which then can contribute to elevated androgens. So to treat androgens, we must test and address the root cause, which could include inflammation, insulin resistance, stress, and excess fat tissue. A few simple diet and lifestyle things you can start doing today include adding 2 to 4 tablespoons of flaxseed to your diet. Some studies have shown that this can be really beneficial in reducing testosterone, and even without that, it can help to reduce inflammation, which, as I said, that can then indirectly help with the testosterone. So flaxseed can help reduce inflammation. It can also help reduce triglycerides, which is a blood fat. Flaxseed has also been really effective been shown to be effective in regulating the menstrual cycle as well. The second thing would be drink 2 cups of spearmint tea per day to reduce total and free testosterone. Start a regular yoga practice. Studies have shown that this not only reduces testosterone, but it can help to normalize or reduce some of the other hormonal imbalances in PCOS. And then lastly, start to use myo-inositol. Studies have shown that it improves testosterone and also helps to improve insulin resistance.